of the individual. These are the drugs. When misused, are referred to as substance abuse. So the word drug abuse is a blanket word covering drug misuse and substance abuse.
So is it clear enough? Any question? Any question? Because of those at the back, it has to be loud. So just bear with us. Any question? Okay, can I throw my own question now? What do you understand? What is the difference between drug abuse and drug misuse? Anyone? The difference between drug abuse and drug misuse? But you said no question, and you said it's clear enough. Okay. Let me make it simpler. Can someone tell me or tell us what you understand by the word drug misuse? Okay? Hold on.
Drug misuse is the taking of drugs without the doctor's description.
Let's put our hands together for her. Drug misuse is taking of drugs, these tablets, without doctor's prescription. Now, can someone tell us what we understand by drug abuse? That is substance abuse.
Drug abuse is the harmful use of drugs. It's the harmful use of drugs.
Thank you very much. Let's put our together for him. At least it's better than those that did not say anything. Only that he did not arrange it very well. Drug abuse is the misuse of harmful substances. When you misuse hard drugs like marijuana, codeine, Refnol, tramadol, etc. These are tablets that the doctor specially use for a purpose. You don't just use these tablets because you feel like getting high on something, or maybe because you feel it's necessary to use them. The doctor prescribes these drugs for a specific reason, which is very, very important for you to understand that cocaine has different level of, let me now put it this way, we have different kind of codeine for different age. We have for the old, we have for the young, we have for babies. So whenever you are having cough symptoms now, you go to the doctor, you say, I'm having cough. Then he run a test on you. He prescribes the particular type of codeine you are meant to take. And the amount you are supposed to take per time. If it is once in a day, maybe in the night, take half spoon of codeine. The doctor will tell you. If it is twice in a day, half in the morning, half in the night, just half teaspoon. Now codeine is what many people just branch out and then consume, all in the name of they want to get high, they want to get tipsy. You can imagine. Meanwhile, codeine is a cough syrup serving different purposes. We have for the old, we have for the young, we have for babies. You don't just go to the pharmacy and demand for codeine. Now, let's listen to an advice to all parents. Listen carefully.
Hey parents, can I ask you a personal question? Do you have any prescription medications in your house right now? Maybe painkillers from a previous surgery or Xanax to help with anxiety? The reason I ask is because the misuse of our prescription drugs by our own children and their friends is leading to addiction, overdose, and death in your neighborhood and mine. Did you know every day in our country, 1,100 adolescents start to misuse prescription pain relievers? About 2/3 of teens who abuse prescription drugs get them from family members, friends, and acquaintances. Following marijuana and alcohol, prescription drugs are the most commonly misused substances by our children 14 years of age and older. And to make matters worse, only about 50% of our children understand that prescription medication can be dangerous when it's misused. It's time to start talking to our kids, and that's why I'm making this video. Starting these conversations now, while our kids are in elementary school, is the best way to prevent problems in middle and high school. We are the most important influence on whether our children will decide to use alcohol or drugs, and just by teaching them about the risks, they are half as likely to use them. We can do this. So, what prescription drugs are our kids misusing? Let's take a quick inventory. Do you have any OxyContin or hydrocodone in your house? These are painkillers, also known as opioids, and they are the most commonly misused prescription drugs in the country. Do you have any Valium or Xanax in your medicine cabinet? These are depressants used to relieve anxiety. What about Adderall or Ritalin? These are stimulants used to treat attention deficit and hyperactivity disorders. If you or your children are currently taking any of these medications, keep them locked up and out of reach. It's important to know these medications are being misused. Sometimes parents share their own medications with their children. Some medications that come in pill form, typically painkillers, can be crushed and then the powder is snorted. Some kids may mix the prescription drugs with other drugs or alcohol. If you hear the term farm party, think farm party, where kids grab a handful of pills from home, take them to a party, throw them in a bowl full of other pills, and then chase them down with alcohol. And some kids will simply take a prescription drug just to get high. No matter the method or the reason, the outcome is the same: potential for addiction. Now's the time for us to get out in front of this issue. Here are some tips to help you start the conversation. Explain to your child that prescription medications and non-prescription medications like Tylenol and Robitussin contain chemicals that change the way a person's body and brain work. Your son or daughter's brain is still growing and developing, so it's mom and dad's job to make sure that they stay away from any bad drugs. Explain that when a doctor gives them a prescription drug to help their body fight an illness or for pain.
Hold on. The reason why I'm posting this video right now is because I want you all to really understand what she's saying. And I hope you are following the message. It's very, very important. See, let me tell you something. She's talking about what the psychiatrist Theophilus explained concerning drug misuse and drug abuse. So, this message is directed to the parents, but you are not a parent yet, doesn't mean you won't benefit, because indirectly the message is meant to be passed across to the children. And with my understanding, you are all mature enough to understand this message clearly. So that's why I'm playing it to you, so you can also benefit from the message. That you don't just see tablets and consume. Maybe because when you were strong, let me use that word, let me not say sick, and they gave you that particular tablet, the way you felt, you understood that you were a little bit high. You felt a little bit of flow of energy in your body. But the reason why you felt that way is because these drugs serve a very, very important reason to your body. And if it's being misused, if it's being abused, maybe you take them without the doctor's prescription, or you just find them anyhow, and then you begin to mix them inside alcohol or inside drinks, or you mix all kind of drugs together just to get high, just as she said. It is very harmful to your body and especially your brain, because these drugs have effect on both the mind and the brain. So you might not really understand in the early stage, but it will get to a point whereby you begin to get so used to these drugs, and you will not be able to do without them anymore. So at that junction, at that point in time, it will start reacting on your body system, especially your brain. Then you find it slow to assimilate. Like now we are passing a message across. God forbid if there's any drug addict among us here, such a person will not get the message because why? All we are doing here is too fast for him or her to assimilate. So I'm going to pause this video here because of time. When next we meet, we will continue. We are not meant to rush this program. You are meant to, how do I put it now? We are going to do follow-ups so that every stage that we have this opportunity to pass our message across to you, you have something to learn. It doesn't matter how short the message is. All that matters is you are getting something. And we have a long way to go. So within few weeks or few months, I'm sure you really have sound knowledge on issues pertaining to drugs. So for now, you permit me to leave. So when next we meet, we'll continue from where we stopped. Thank you very much. God bless you.
Mike.
Where is Victor? Victor, where are you? Okay. Please, Victor, can you come out? Please. Please clap for him. Yes. You know that our president is not around, so second in command is around. Please, on the behalf of the students.
Good afternoon, everyone. My name is Ata Victor. So, we Fanlot would like to thank Brighter Light for enlightening us on drug abuse, misuse of drug and addiction. So, we'd like to say a very big thank you.
You're welcome. God bless you. We appreciate it. Thank you very much.
Thank you very much. Great applause for listening. God bless you.